I don't know. But actually, I thought it was interesting what you said, Hunt, though,
Being
too, because
recorded.
I feel like it is a push-pull because, like, as we all know, like SGU provides so much of their, like, the economy down there, like, not only with the school itself, but anyone, like you said, that works with the students, even when you're, like, living off campus, if someone comes to clean the house or cook, or people that, deal with your automobiles. But then at the same time, like you said, like, is there resentment now among locals when talking about, this large amount of, students coming in? Are they the reason now that we're having a breakthrough crisis? So I feel like it's like really, it's like a tough spot because like they rely on SGU so much as a country, but at the same time it could be that SGU students who are bringing it in. So that
Yeah.
is interesting.
Yeah, and I remember when I first moved down there, they were all like, the Grenadian GDP is 60% us, and
Oh yeah,
I,
probably more.
yeah, and I remember like when I moved down there, I loved it. Everyone was so friendly, but by into year two, I honestly felt like everyone just looked at like me or my friends or any of us students as like a cash cow. You know what I mean? They just thought we were like the most rich people in the world, and how like I got yelled at one time leaving, like how dare I didn't give some guy money, and I'm like, I'm struggling too. I'm paying double what it would cost to rent a car or own a car in America. Just that's 10 years old, 15 years old. Like, you know, and I just
Mhm.
kind of,
I knew how much debt we're all in.
I
I
know.
know.
And that really started to really just get on my underneath my skin towards the end, because it's like you are literally charging us $500 American dollars for a 2010 Suzuki, or 2005 Suzuki
Or
with the doors hanging off and no AC and this, and I'm paying five. I could have a brand new BMW sitting in my driveway with no miles on it, paying that much. You know what I mean? Like, so I don't know.
Sorry, I think going off of what you were saying, that some of your friends got COVID and what, sorry, I think he's here.
Oh, oh no, that's Keenan. Hi, Keenan.
Hey Hunter, good to see you. Yeah, I'm just since the way they assign the professionals is like each professional has 4 groups and there are two professionals per group. I'm just going from room to room looking for mine. I haven't found them yet. I've been in almost every room like multiple times.
That is
Oh,
funny.
okay. That's
See you
hilarious.
guys.
See ya.
Yeah, we'll get to see one.
yeah.
Yeah, so back to what I was saying, I think eventually, just like how we have to get the flu vaccine every year, we're going to have to get COVID vaccine every year, because they're already starting with the booster shots. So I'm just like, it's just going to become like a routine vaccine at this point.
Yeah,
So,
and I feel like that's going to be a big thing with these small subsets of populations where we're talking about how preventative medicine isn't um, a forefront in their healthcare system, because they're not going to want to get their boosters. So, are we going to see a repetitive cycle of COVID-19 spikes, flu spikes? Overlay of both those, common cold, flu, and COVID-19.
yeah.
I think it's
Also,
highly possible.
It's free now, but eventually, like when people may decide that they want to get the vaccines, it may not be free for the Grenada government to like get the vaccines and stuff. So it may be too late at that point. So I think people should just like take advantage of the free vaccines now, because everything is money making, and if we're going to get donations from America, I think eventually we're gonna have to pay for it. So it's just going to turn into a shit show basically. So I think we'll just see
Also,
what takes place.
too, I think it would be interesting to see like data in terms of the timeline. I know even now, I mean, I don't know everyone, but think about like the flu vaccine versus now the COVID vaccine. How long did it actually take to like one, get the flu vaccine, even though I know it's every year it's based off the previous years and it's not like 100% accurate, but how long did it take to get people actually on board for the flu vaccine to the point where it is now for most people, how it's like you said, just regular every year, like, oh, okay, I'll go get my flu vaccine. Or like for us as students to even be able to be in the hospital or to attend clinical stuff like that, like we needed to get our flu vaccine. It's like, I'm curious what the data will show on how long or like up to speed it takes for the COVID vaccine to become, you know, the same commonality? Like, are people going to be more reluctant? Because like, in my opinion, it should probably be the same, or if anything quicker, right? Because it's like, you would think there'd be less pushback because people are like, oh, well, there's been something like that in the past, like the flu vaccine, and people were reluctant, and now look, everyone gets it and we don't even think twice about it. Well, but for some reason I feel like it's going to be the opposite, and I don't really know why. Like, I you know what I mean, I'm trying to rationalize to myself, like, well, why wouldn't it be at least the same timeline, if not quicker, for people to conform to it? But for some reason I feel like it'll be double, like it'll be double time before people even see the
Okay.
need for boosters.
Yeah.
I think just at like kind of my opinion on that point is I think it has to do a lot with like politicization, the stigma behind, you know, the vaccines. That was never a thing before. Maybe very like minuscule part of the population, you know, would be hesitant towards the flu vaccine. You know, there were always those people that would be like, no, I've never gotten the flu, I'm not going to get the vaccine. But I don't, it's just this day and age, and the, I guess the ease of spreading misinformation through so many different types of social media, so many avenues to spread this misinformation. I feel like that's playing a big role in, you know, the hesitancy and how it will take a long time. I agree, for the COVID vaccine to become like the norm, like not many people, you know, opposing it and stuff.
Right.
Well, I think you see that too, because like I remember, like I read this article about how this TikTok user pretended to be like she got the vaccine and pretended to be like walking funny and all that stuff, and it comes out that it was a hoax. But you have that kind of misinformation all the time, and it's so dumbfounded. And I think one of the big, if we take that and how that happens across the world out of all social media platforms, I think one of the biggest challenges we face isn't just the actual fact of social media, but it's the fact that our society is so lazy that they're not actually diving in to like double check and check these facts. They're not, you know, yes, you can Google something and you're going to find couple web pages that are, you know, pro whatever you're searching, but to actually take the time to say, hey, this says this, and you know, over here some Wikipedia and blah 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 says this, but these are more solidified, or you know, I can't think of the word, but anyway, better resources. So you have that, and I think it's just based off to the fact that our society has become so dumb, in the sense of we are so stuck to Netflix and letting our brains, we don't want to utilize it past watching a video. We would rather watch a video and believe what they're saying than actually read a document or read a journal article. And I'm guilty of it. Trust me, I freaking hate reading. You know, but like, I think that it's like a more pressive underlying issue outside of social media. And I think that's why a lot of the targets have to be towards social media.
Everyone has a smartphone too, so it's like at your fingertips.
Well, I think it's funny though too, is like it's, you know, it's been regarded now as, you know, our generation and the generations that are younger than us, this accessibility to technology and having it at our fingertips, and you know, little kids going right, you know, immediately having iPads, and like, oh, you guys have all the access to everything in the world. But like what Hunt said, I feel like it's, if anything, it's like the opposite, or deterring, because like you said, like people are just willing to jump on any information. Like they'll take anything at face value and they won't look into it, and then that's bad enough for that person in general, but then that person will take it and disseminate that information. Oh, did you hear this? And then that person, you know, they're telling, will go, oh, where'd you hear that from? Oh, I saw it on here. And there's never a discussion about like research done or like any supporting evidence. The discussion is always about where did you see it or who did you hear it from. So like, I feel like the technology thing is just like it's like really like a fallacy in terms of like us being more educated, because yeah, like it's more easily accessible, but the willingness to access that knowledge, like that's dropped off markedly, I would say.
I think that's going to be the fighting issue moving forward for the rest of our careers, to be honest. I think we're only going to be headed more towards technology, whether, I mean, smart homes, smart office buildings, you know, shit popping up because you have a contact lens in your eye, like whatever the case may be,
Those
whatever.
glasses now are coming out again.
Yeah, I think that technology is going to be such a big center around it. And I mean, there has to start having some kind of limitation on what people can post, or then that goes against our free rights, right? Free speech.
There's really no way.
You don't definitely want to end up in a totalitarian society where everything that we're allowed, like China, is,
monitored.
Yeah. But we won't see historians come. People won't be wanting to study philosophy and create poetry, because that's all going to be dead languages. It's going to be who can create the next TikTok dance.
But seriously, everybody's going to become TikTokers and Instagrammers in the next couple of years.
Yeah.
So
how do y'all, I mean, since we're not, we don't have a professional yet, how do y'all feel, like, how do y'all want to take this project, right? Or this is for the project pitch first. So how do you want to do? Do you want to like create an advert for Instagram? Do you want to create a website? Do you want to just create a PowerPoint or a video? Because it says audio and video, so we can go. It's kind of
so I think in the culture of Grenada, because it's very like carnival oriented, and you have like the job and all these things, you can like incorporate these things to kind of like influence people. So for example, like, I don't know if you all know, like the injection itself is a job, and we could like play off of that with the job to kind of like encourage them to like take the vaccine, to make it more marketable for Grenada, because everything is job, like literally. So that was just like one idea that I had.
Yeah, that's cute, actually.
I love that.
I guess, yeah. I think this could be actually a pretty good project to work on. If we actually come with something that's beneficial and help, I mean, that is something we can definitely put on our CVs for med school. And it's due in 2 weeks anyway.
Yeah. It really is not going to help us, but fellowship probably.
Yeah. I mean, no, this is actually considered like a publication.
Okay.
You could put it as like an oral presentation or a poster,
Yeah.
How though? Won't we already be applied by then?
Yeah.
No, because it's due like October 3rd. So I mean, right?
What is
but
the
how do you
October
add
3rd?
it to your applications if they're already submitted by the 29th?
Well, as long as we get it done by the 29th.
And published.
That's due on the 3rd.
Huh?
Just our pitch for the idea that's due on the 3rd, I believe.
I think the thing goes all the way to the end, no?
Yeah, probably.
Yeah,
Yeah,
like
the end of the
November.
term, November 12th.
Yeah.
This I don't think that we're ever going to have a professional in it. There's like 100. It's always like the classes I always look at every day. There's like 15 people, 20 people, 30 people, and like today there was like 120 people, and there's like 3 professionals to go to these groups, and I'm like, it's already 12:30.
Is anyone good going back to like what we want to make the project to be, like a video, PowerPoint, whatever? Is anyone good at any particular platform to create anything like that? I'm garbage at
Same.
yeah.
That's hilarious.
I mean, I guess I can do PowerPoint.
I can do PowerPoint.
Yeah.
Everyone can do PowerPoint.
I
No,
can't
but-
like
But like if we wanted to do something like a website or whatever, like that could be, there's website builder things online where you just kind of like pick shit. And
There's like Squarespace. I always get ads for that. I don't know if that's relevant. They like, it's the same thing. You like put things in.
We'll just put an ad in the newspaper.
Target the 55 and older.
Oh gosh.
Yeah.
Yeah, I was thinking for simplicity's sake, the easiest thing to do would probably make some sort of poster that could be posted around the island in public spaces like bus stops, or I don't know, any boards where people post things. I know there are a few of those on campus, or at the mall.
We could also like do like a quick video and like just kind of like, you know, like Hazel was saying, jab, jab, and then just like get the jab, jab, and then have like a slide up link, like for you post on Instagram, and it has like a link to like a website that says, oh, this is what AstraZeneca, these are facts, pros, cons of it. Here's Pfizer, you know, make your own decision, but get back, like kind of give the information that we're all seeking, like not just go for Pfizer, go get vaccinated, but actually give them the documented resources or the references with references, and have it say like, this is actually what it is. Nothing on this website is falsified. You know, you get to make your own decision. And then maybe even have like one of the pages could be like the importance of preventative medicine compared to treating, right? Prevent with the vaccine, you don't have to worry about dying later.
And I also think too, like the sources, like if you like we were talking about, like people respond better, especially obviously younger people, like definitely respond better to like shorter information, in the sense that like every time like we are even told like to read an article or like a paper, like it's always like, oh, I skimmed it, or oh, I read that. Like I think it would be best if like any of the information that's given, like Hun said, is like quick facts, like bullet pointed, or like a graph, or even just like a statistic. Like people love statistics because like you can give them 5 pages of like awesome solidified evidence explaining every little detail, and they won't read it or they won't understand it. But if you simply show them, like I read something like yesterday, it was like there's 23 people with COVID in the ICU right now. Here's a statistic: 22 of them are unvaccinated. One of them had the vaccine. And like just immediately for me, like that resonated. Just like I just thought like, oh, how would someone like not in the medical field even react to this? Like they would do a double take, because like all you need to do is show like a statistic that grabs people. Like, oh, like that's easy. Like out of 23, like 22 weren't vaccinated. Like that's going to strike a chord.
You know what else we could do?
Paragraphs of literature isn't going to.
Yeah, you know what else we could do? Scratch like the whole website and trying to attract people to go do it, but we could also just become our own social media influencers, in the sense of creating like a Grenadian COVID vaccination Instagram, and then promoting posts and followers, and like trying to like gain. And then part of that could be just like what you're saying. If it's not bullet pointed and you can't screenshot it and make a meme, people don't care about it. So why not make memes, and why not present the information? And we could, you know, reach out to Dr. Ford and say, hey, like what is the statistics of vaccinated versus unvaccinated in your current hospital at this point in time, or the patients you've seen, or what is some data that we could correlate and transition and post. I mean, it's easy to get followers. All you got to do is follow one person and follow all the people that they're friends with, so that way and then, you know what I mean? And especially on an island that small, it wouldn't be too hard to promote an Instagram page. That we could have things as where all the local clinics are in the area that provide free things, so like Dr. Lowe. You know, I think that it would be more of like a beneficial, helpful thing.
But yeah, I think it's a great idea.
Yeah.
And it's really easy to do. Everybody like knows how to make an Instagram account, so at least you don't have to have an IT degree.
Mm-hmm. That's true. I think it would, you know.
And we're meeting at 5 today, right?
Oh boy. Yeah, I think so.
Right? Yeah. Okay.
I mean, we don't really have to meet if we're talking it all out right now.
No, that is for the discussion post, not for.
Oh, okay.
Yeah. I'm totally different.
I was, when you said that, I was gonna be like, oh, sweet, but then
yeah, so many things to keep up with.
But I think these are all things that we should definitely like think about. Like, you know, what do we each individually have time to do? Because we all have different schedules. So like that's a big consideration of what we decide to do. Mm-hmm. So don't hold back. Don't be hesitant on like what your opinion is on the matter and how we proceed forward for our final project, whether we want to do this, that, you know, make a simple poster, do an oral presentation, if we want to do an Instagram, whatever. They're all great ideas. I think it all depends on how much time can each person individually put into it. Are they willing, are you actually willing to it? That is the questions we have to ask. But I think, it doesn't have to be decided today. It can be something we just think about and then bring up later.
I just have a question concerning the Instagram, because I really do like the idea, but in terms of the post, like, so if we post then like the stats, we still have to like go like make the flyer or whatever to post it on the Instagram group. So it kind of like, it gives us like double work, because it's like we always have to be posting like not regularly, but like, have substantial information on the site. So then we'll have to like, make the flyer separately and then post it on Instagram.
That's true. Yeah, it's a lot. Yeah, that's what I'm saying. It's a lot of work. I mean, you have to create it, you'd have to post it, you'd have to have it post at least once a week. One person would have to be in charge of, but we could also separate all that stuff too. One person can be in charge of going and following people and like, messaging people and like getting that aspect of it. So that way it becomes popular, figuring out like what hashtags work in Grenada right now, like what's the popular hashtags with people of influence there. So yeah, I mean, it's something that could take time, but at the long term, if you really think about like our future and our careers, like having this as like, even if we don't like in our future, like, we created this and did this and this for Grenada to, to increase preventative medicine. And like, I think it's
we'll agree.
But, yeah. So anyway, I think it's something we got to consider. I'm down for no work, and I'm also down for a little something.
I don't think you want to say that on record, because we're being recorded right now, so take back your statement.
Oh no, his audio
You're done
cut
for
out.
a lot of work.
Oh, what? My audio cut out?
Yeah.
No, sorry, go ahead.
Oh, I said
He said not too little of work. His audio cut out. Yeah.
Oh, that is true. Sorry.
I was like, no work or a little work, whatever. Okay. What else? Let's see this.
I don't know what else, yeah.
So
I sent that survey into the WhatsApp, and then I was trying to find on Instagram a couple weeks back, I saw some physician posted about the long-term effects of vaccines and how nearly all vaccines long-term effects happen within like 6 or 8 weeks, but I couldn't find the post anymore. So I was trying to find articles about it. And so I sent an article that I found, it's a random National Geographic article, but they quote a bunch of doctors who work for like immunization, the Immunization Action Coalition and the CDC and the NIH. And they're all saying that long-term effects of all vaccines rarely happen beyond 6 weeks. And since that was like the main concern in that survey, I felt like that was an important point to put in whatever we create. I think it should touch on that, since the majority of the participants in the survey were concerned about long-term effects. So that was just one thing that I thought of, but yeah, I'm trying to remember the other long-term effects or the other concerns that people had.
We can definitely use the survey results to kind of target the big topics that we want to, cover in whatever, if it's the Instagram account that we want. I think that's a good idea.
Yes, I think the second highest ranked concern was the overall safety of the vaccine. And then the third was immediate side effects, but more than anything, people were concerned about long-term future effects.
The immediate side effects just sucks after the second one.
I mean, I didn't really get any side effects, so it really depends on
You're so
the individual. But I had COVID, so I guess that's also probably why I didn't have side effects.
I was also kind of happy I had such a horrible like flu-like reaction, because I was like, go immune system, go.
Did you have Pfizer or Moderna?
I had Pfizer.
Yeah,
And
I
Hazel,
Pfizer as well. Yeah.
do you have any long-term, like long COVID?
Oh, I still can smell
Oh,
all the
wow.
way. Yeah. It's just, it depends. Like, it has to be like a really strong smell for me to like pick it up. But other than that, like, I'll just sit in a fire and I won't be able to smell it. I'll just sit down.
yeah.
How about your sense of taste?
So that is very strange because they say that taste is associated with smell, but my taste isn't like affected like that much. It's just like my smell per se. But I had a really mild case of COVID, so I don't know if that's probably why. Like I just had like one day of symptoms.
Yeah, I got COVID April 2020 when I was still in New York and I lost my sense of smell. And my roommate got COVID in November right before Thanksgiving, and he was like on the couch, whatever. 6 of us, all of our friends, got it at a birthday party, and I didn't get it. I still had immunity antibodies then, but I still have like diminished smell. It's just now starting to come back. I changed my deodorants, I changed my body washes. They all smell like trash. It's like it took away, like there's like an overpowering chemical that they use in a lot of the men's body washes for some reason, that like my nose just picks up substantially more than anything else. And as far as taste, I never really like lost my taste. There were some things that I felt like tasted better, and there was some things that I tasted and I was like, oh, this has a different taste, but it was never like completely like gone or anything like that. It was weird.
The same thing happened. Like I was using my husband's like spray deodorant, and I almost passed the hell out. I was like, "What the heck is this?" Like, like I could not. Every time he wore it, I'd be like, "Get away from me!" But like now, it's like more bearable. But it's like honestly, it's the worst thing ever. And when I had it like initially, I couldn't smell a thing. Like honestly, like not a thing. It's so scary. Like. But that's just COVID. I'd rather have like loss of smell as opposed to like being in the ICU. So it just depends.
Yeah. I had surgery rotation right after my first rotation back in the hospital, which was glorious not to have to actually smell. Because they are nasty.
I know, right?
All right. So what do we think, I guess, as like let's see, trying to go through these questions and kind of see like our viewpoints of where we stand on it. What do we think are the greatest concerns of like long-term future effects of the vaccine?
I know people were concerned with like fertility. That's still a big thing.
You know what? My roommate, he's a surgery resident right now, and his chief's wife is like 30 weeks pregnant. He ended up bringing COVID home to her, and I need to find out because I guess 2 weeks ago she was in the emergency room bleeding. 30 weeks pregnant. I need to find out if she lost the baby. That is what I will do today. But so I'm curious to know whether the long-term effects of COVID on pregnancy.
Is there any data on that? Are people concerned about that?
I think some women were complaining about changes in their menstrual cycle with the vaccine, but then they said that it didn't have like any correlation, but like because some women complain about it, everybody's going to jump on the bandwagon and say it's going to cause fertility issues.
ACOG came out with recently, maybe like a month ago or less, they came out with an official statement saying it's safe for pregnancy, it's safe, for your fertility. It's gonna, but people still are hesitant. But I know that, that information may not be readily accessible to everyone. That, this big organization in the US based made this statement. So in Grenada, it could still be a concern potentially.
Okay.
Any other long-term effects?
I know this is kind of a blanket effect, but a silly thing that people have been talking about is that the vaccine is going to change their DNA, and whatever effects that'll end up happening.
I've seen that too. because they're like, well, HIV changes your DNA or you know, the infection, and they're taking the fact that it's an RNA vaccine and the fact that we have RNA diseases that are so crippling like HIV. But one of the big things with that is, you know, there's no reverse transcriptase embedded in these vaccines. They're not going to create a live version of the virus just to be back and you know, replicated. But I have seen that actually, and
I thought of it because I actually had a doctor's appointment this morning, and they had a poster in the room about getting vaccinated. And one of the points on it was, it will not change your DNA. And I thought, wow, people are really concerned about that happening, that they're putting this on their poster.
Honestly, I just think people are just like making any excuse not to take the vaccine. Because like you could go out in the sun and it could break your DNA bonds, but you don't see everybody inside, like, you know, avoiding the sun. So it's just like all like, you know, bunch of mush as to why they don't want to take
It's true. People didn't want it before because it wasn't FDA approved. Now it's FDA approved. Now they found
exactly. Exactly.
And, you know, I tell people that like are against it, I'm like, yo, I understand your hesitation for a vaccine, but look, we've never had one vaccine created with every greatest mind on the planet working on it at the same time and including their input. That is why it was so successful. You had everyone turning away from their day-to-day research, whether it be HIV or this or that. They all collectively came together and said, what's the best way for us to get this vaccine out and done, and how do we do it, and what the trials? I mean, think about the manpower and the lab power that it had to go through and the conditions they were working under in those labs, trying to, you know, and the COVID outbreaks in general. They were probably getting COVID anyway. So, you know, you say that kind of stuff and it's like, really start thinking about it. Like, I get your hesitation, but no vaccine, nothing in the world, no drug has ever prompted a response from the most educated people in the world at one time that this has, you know? And then it gets so annoying too when I hear, like, you know, I'm from Texas, so, and I have friends like Oklahoma, and, you know, they're all rednecks. And I hear them say like, oh, you know, this whole mandated vaccine, you're not going to put anything in my body. And it blows my mind that they're so willing to be against that, but then they would love to tell a woman whether or not that she has to keep a fetus inside of her own body against her will. But you're fighting for your right. I was like, the hypocrisy of it all. And I'm like, you have all this. And I was like, you're right. As America is in your 10 commandments. You have your right to your freedom of your speech, your right to bear your arms, your Fourth Amendment right, like legal search and seizure. But your right is not to jump on a plane and go to France. That's a privilege in our own rights that we have adopted to think as a right, but it's technically a privilege. You don't get to go to concerts. It's not your right to go visit with friends. It's not your right to enter a grocery store. And I think that's what, you know, misconception that is whatever. And I don't know why I just went on that tangent, but I guess, you know, moving on.
No, it's important. It's I agree with everything you said. It's people often mix up, you know, what's a right and what's a privilege.
Yeah, that's a good point. There's like a fine line between personal rights and like your rights to be safe in public, like from a public health safety standpoint. Like, you're infringing on other people's rights to be safe if you're gonna impose whatever viewpoints you have against getting vaccinated.
I'm just also like curious to know, like, all those who are hesitant to like take the vaccine, if they still like eat McDonald's, or if they still, you know, excessively drink alcohol and all these things, because those things have like more harmful effects than probably the vaccine itself, but they still continue, you know, using these products. So it just really depends. I don't know. I think the media had like a really negative impact on
Hello,
the vaccine.
Hi.
how are you?
Hello. I'm good. I'm good. My name is Colin Campbell. I'm a journalist, one of the media professionals. I just wanted to indicate that I'm joining this group. I just left, I think 13, and this is what, 15, right? Yeah. So I'm just letting you know that I'm here. Yeah.
Gotcha. So you work for the Grenada Broadcasting Network, right?
Yeah, I used to. Now with No Grenada, it's an online platform. Actually, it's a more popular online platform in Grenada.
Yeah, I used to follow now Grenada when I lived there. So
yeah,
I was slightly familiar with it. Awesome. Well, welcome. I guess we have some questions regarding your focus is basically communication, right?
Yeah.
All right. So what are some of the main barriers you're finding coming across of getting the message out to population?
Population to get vaccinated? Okay. All right. Well, we all know that the conspiracy theories are beating the actual information from professionals, right? So that is a major issue. But let's just localize it here.
Yeah.
One of the critiques that I've had with the official message coming from the Ministry of Health in the beginning, that's prior to the community spread and so forth, and the Delta variant and so forth, is when you have the ministry saying to people that you get vaxxed and you're going to have mild side effects, right? Now, what I understand, mild side effects to a doctor and mild side effects to a patient is two different. Mild. Am I making sense?
Yeah, no, you are.
Right. So let me go further. So say, for instance, one of the things that I've realized happened, and it's scared a lot of people from taking the vaccine in the early, that's last year, that's in the early setup when the AstraZeneca vaccine was available, is that let's say I choose to get vaccinated early, and then I start coming and I'm listening to the health professionals saying just mild symptoms. So I'm thinking, oh, I'm just going to have a little chill, just a little soreness at the injection site and so forth. And then boom, I took the vaccine. I have a headache for a whole day. I have chills. That's just not normal. I'm feeling ill for 3-4 days. I can't go to work, whatever. I'm going to go on social media and I'm going to exaggerate, right?
Yeah.
Because to me, I'm feeling like I'm going to die. You gotta let's be honest here. Like, I mean, the average person is not a medical professional, so they're going to exaggerate on social media, and then that now is going to be fed to the people who actually wanted to take the vaccine, but then hearing that I'm going to be that sick, but they told me mild symptoms, so that means that they're lying. You see the point that I'm making? So add that with the conspiracy theories and the other elements, then you have a concoction there for an explosion. So what I suggested to them that they be honest. When I say honest, I don't mean that they were lying. I'm just saying, like, give people all the information or whatever, all the information that you have available, and do not downplay the side effects, because people's feelings, it's like you downplay my feeling. Like, if I feel like I'm going to die, then I'm going to exaggerate that, and I'm going to make somebody else fearful to take it. Another thing is that we need to understand the demographic that we're speaking to. So say, for instance, I have a doctorate in science or whatever. The way I would speak to someone who probably just graduated from secondary school, if I do not have the effective communication skill to be able to, convince someone who, does not have that level of education as myself, then it's like you're going to come across as a condescending, like you're talking down to them. And then you downplay their feelings. What I think is most effective is that if you try to understand where they're coming from, even the people who are anti-vax, even the people who are spreading conspiratorial information, we need to understand where is that coming from and not downplay them because we know better. Am I making sense?
Mm-hmm.
Mm-hmm.
Right. So it's now we need to understand the people who we're speaking about, understand why is it that they're thinking in this particular way, understand that we also have another issue again. So there's about 3 things I think I mentioned. So the third one is the political climate also needs to be taken into consideration. We've had historically a political climate where we are begging our governments to listen to our plight, right? And we're not being heard. We're not being catered to. And then all of a sudden we see our politicians now begging us. It's like, hold on. Is it that you stand to benefit more from this than I do? I'm just giving you the perception, the different perceptions that people would come up with. And the majority of the people who are actually pushing the vaccination campaign are the people who stand to benefit more from the system. That's another thing that we need to consider as well. If, like, say, for instance, right, if I'm a billionaire and I'm pushing a vaccine, and prior to me coming and saying, I love you people, I want to help you, so you should be vaccinated. Prior to that, I used to ignore them. Then I'm not going to listen to you when you see the point. You see where I'm going with this. Right. So yeah. So I think yeah. So the people who stand to benefit are the ones who are pushing the vaccination process, while the people who are anti-vax are those who are disenfranchised from the beginning, and that's what I'm seeing.
Okay.
So if you want to target a particular segment of the population, you need to use the people who represent them the most and the people who they trust. Yeah, sorry, but I know I went on.
No, you're fine. So for you mentioned that the ones who are pushing for the vaccination will benefit the most. Is there like you talking about politicians? Is there a certain family that has their hand in all the pull, or all the different areas?
No, it's not. It's not really, and what I'm seeing is that when I say stand to benefit, the people who were all right. So you need to understand the economic situation in Grenada. All right, a lot of us live below minimum wage,
Okay.
a lot. All right, but the people who are really the ones pushing the vaccine are the ones who are living comfortably. You catch what I'm saying?
Gotcha.
Prior to COVID, so it's like, it's like all of a sudden now you so care for us. These are the things that are going to play on the minds of poor people, and then they're going to rebel. Now we're seeing a difference because now we're seeing the reality of COVID and we're hearing about the deaths and so forth. Now people are more inclined to take the vaccine because now it's a reality that, you know what, not only do I stand a chance of dying, but also my economics is being affected now, because how long could I hold off from being anti-vax, from having that stance of being anti-vax? How long could I hold that up? At the end of the day, I have to eat, I have to live, I have to earn money, and that would not be able to happen. So, but all of these things, you need to take in consideration to understand, is it that people are vaccinated, hesitant.
Okay.
Yeah. Am I making sense? If I'm not, please just let me know. Huh?
No, you're making sense.
Okay.
Sorry, I had a question. So do you think it may be useful if you use like local artists to promote the vaccine, like soca artists and stuff, since the Grenadian population may be more trusting of these people? So perhaps they could promote the vaccination drive?
Yes, but we also have to, yes, that could work to a certain point, but you have to also remember that people could also think that they stand to benefit as well. You see the point I'm making, or they're getting paid to push this agenda. People could have that kind of perception. But what I think you should do is, if you can get just a common person, a person who really doesn't stand to benefit from the vaccination drive. You catch me? Someone just on the ground, someone who's a regular blue collar, white collar, worker, to really speak about the vaccine. And then if you can get someone who was actually affected and who almost were on the brink of dying or suffering, to come across and bring across the information of the seriousness of this and to get vaccinated. Yeah, I think those are more effective communication tools that you could use than to use professionals or to use soca artists or even influential media people, even though they have their roles. Everyone have their role. Okay. But if you want to target the majority of people, you have to use people that represent them. Yeah.
But perhaps if we use regular folks, then their credibility may be questioned, because so then that may pose a problem as well.
True. Like I said, it's a combination. So it's not just solely using. You see the point I'm making? It's a combination. You need to use different people. But then again, you have to use them effectively. So all right, what should I say? So say for instance, you have a town hall meeting, right? You're going to have a doctor, a representative, you're going to have a politician. You also need to have a religious, someone from the religious segment. And you also need to have a regular person, so you have these people together sending across this message, then you would reach a wide audience. So you understand? Yeah. So it's not just using just one set of people, because everyone has a role to play.
Gotcha. How is misinformation about COVID-19 in the news and social media being mitigated on the island currently, from your perspective?
Wow. Well, that is a difficult one. I think, the government information service is really the one pumping out a lot of, trying to dispel a lot of the myth and the myth and the conspiracy theories. They're the ones really putting out and telling people, look, you need to get the information from the right source, right? So they're the ones really pushing that agenda. But what happened later on, which last year, they had a meeting with media professionals, and they were trying to ensure that it included the Ministry of Health, sorry, it included the Minister of Health, and the committee, right, the COVID-19 committee. And they were trying to get all media professionals on the same wavelength, right, to make sure that we are on the same wavelength, that we're sharing the same information, and that, we are on board with this, right? So now we're seeing, media professionals, getting the information from the right source rather than just taking something from off the internet, because those things look credible, right? So you have that, but trust me, it's very difficult to block the false information online, because people are consuming a lot of the information on social media. And and it's only now I think the Ministry of Health is learning how to utilize social media and maximize on its potential. And they didn't have that prior. Yeah.
In your opinion, how readily available is the vaccine in clinics around the island?
Well, yeah, I mean, I think, yeah, it is readily available. Because the Ministry of Health will post information on where you can get it, the sites and so forth. People are well informed as to where to get the vaccine. I think there's more that they could have done, but I think relatively they did a good job.
In your opinion, what could they have done?
Sorry, say that again.
In your opinion, what could they have done compared to just posting on their website?
Okay, I really think that they could have had more remote outlets. All right, so let me tell you, what they're doing now is that they have mobile vaccination groups that will go around to constituencies and communities and get people where they are, right? So that if they had done that in the beginning, then they could have gotten further on. But they were forced to do it because of the lockdown. They're not having, mobile units so that they prevent people from gathering. But they should have done that in the beginning. Not only have just stationary locations where you can get the vaccine, but have remote mobile vaccination units going around to communities. I think that should have been done in the beginning. So yeah, that's one. Hello?
Yeah, I'm just thinking.
Oh, okay.
Is there a particular subpopulation that appears to be more vaccine hesitant? It could be religious sectors, certain, like, is it a certain political party, red versus blue that you find? Anything of that nature?
It's more complex than that. Well, I'm seeing certain groups, religious groups. So let's deal with the religious groups. It's in the minority, right? So you have the Rastafarians, right? I remember doing an article way before the outbreak. That's sometime last year in the early stages of COVID in Grenada. I did an article with a religious leader of the Nyabingi, faith. And that's one of the things. Before I continue, I think you need to understand your demographic. You need to understand the culture of Grenada in order to be able to pitch messages to them. Okay, it's very, very important. Oh boy, I see they're timing me. Okay, so we have the Rastafarians. We have other ethnic groups like the Hebrew Israelite organization. They're anti-vax, but then majority of the religious groups like the Catholic, the Pentecostal, and so they are in support of the vaccine. Who I'm seeing we don't keep good stats here in Grenada, so it's kind of difficult to say, which demographic is more hesitant than who. But I will say that in the beginning, from my observation, I see a lot of old people coming out earlier on to get the vaccine in its early stages. And it's now we're getting to see more of a mix of young people, yeah. I want to say old, I don't mean like in their 60s or so, but I'm older people. Now we're getting to see a more younger population because of the fear of dying. I see I have 7 seconds, sorry.
No, you're good. Thank you for taking the time.
So I hope I was helpful, okay?
Thank
Yes,
you.
you were.
Right, you have my contacts, so keep it.
Email address. They're going to, sorry, Dr. Bob, see your shock face. The students have an email address. They're going to email you guys if they need to have a separate meeting or really any questions. Okay. So students, you know where you can find your email addresses for professionals. It's under their bios. So please use that email address. You can copy me, you can ask me if you can't find anything. I hope the discussions you had so far was productive. And if you didn't get anybody to come in your room, I apologize, time restrictions. We have a second meeting later on and you also have the contact information, okay? Any other questions before we leave, before I wrap up?
For communicating with our professionals, is it only the professional that's assigned to our group that we're allowed to communicate with?
Yes, yes. I mean, I have Dr. Martin. You can also email him if you have any questions. If there's something else you want to relate to another, like Mr. Collmore, email me and I'll get that information to him, okay?
Okay, thank you.
And it's good if you communicate with me to have all the questions sort of in one email and not just like one at a time, right? Great. Any other questions? I'm not.
Yeah, Sabrina, just one question. All right, so I was able to communicate. Oh, sorry.
Go ahead.
Go ahead. Okay, so I was able to communicate with group 13 and breakout room 15. I didn't see 14 for some reason; it disappeared. But how long do we have per group? Because I think I mean they ask a number of questions, and I wouldn't just want to pull out.
Yeah. So
how long?
the session was from 11 to 1. It's 1:07 now. Hello?
Yeah, I'm listening.
Yeah, it's 1:07, so I had to end the meeting. So for other questions and other groups that haven't been able to contact you or you haven't been able to interact with them, you can, they will contact you.
Okay.
If you want to schedule a meeting with them, I can help arrange that. So you just email me, okay?
Oh, maybe one just quick thing. Maybe I didn't ask the question properly. So per session, per breakout room, like is there a time limit to stay with that particular group? Is it done automatically, or I have to manually just tell them, look, guys, it's been 10 minutes or whatever, I need to leave to go to another group? How does that work? That's what I was asking.
Between 4 groups, so I would, just estimate that.
Oh, I need to estimate. Okay, so my bad.
Yeah,
sorry,
the questions they have and the attention you want to give each group.
Yeah. Okay. Cool.
Yeah, but it's over now, so.
Okay.
Next meeting. All right.
Sure. No problem.
Okay. All right. So, any other questions?
Just a quick one. What do we do with the recordings?
Okay, so you have access to Panopto. You can upload it into your personal Panopto. Make sure myself and Dr. Sincere have access to that recording and use that link and share it with us. Okay, so just submit it into your journal log. So when I look back at your notes and I click the link, I should be able to see or have access to that recording.
I have a record button right now when I'm in the main meeting room, but when I was in the breakout room, there was no record button available on my device.
Yeah, I think
on the Zoom interface.
I think you have to be sorry.
Kenan, you were a co-host, right?
Am I a co-host?
If you weren't able to record within your team, I think I gave almost everybody hosting ability. So if you weren't able to do that, you summarize just write up a summary for your journal log.
Yeah, that's what I'm doing now. I figured that I would need to share that with the group.
Yes, and that would suffice. Okay.
Okay, thanks.
All right. Okay, so thank you guys for dealing with all these transitions to breakout rooms and all the technical bits. I wish it would have run a little smoother, but handling 140 something students could be a little chaotic. I hope that the session was informative, that you have a better understanding of the issue and how your project pitch is going to go. I heard a professional relay that they were very impressed with some of the ideas you have. Remember to involve the professionals in your the creation of your pitch. In terms of like ask them for feedback, send an email. If you have their final product, send it to them so that they can see what you've done. Don't just disappear after this meeting and never contact them again. Okay. All right. Christian, give us.
Yeah, I had a question. So I think in the original prompt, it was just regarding the AstraZeneca vaccine. Is that still true, or is this about the AstraZeneca and the Pfizer vaccine?
It's the AstraZeneca and Pfizer. I updated the prompt at the beginning of the meeting. So what I'm going to do is update that in the prompt on your Sakai so that you can see the updated information. So it's not 20% anymore, it's on the 30. Okay.
Okay, thank you.
Thank you so much.
I will also send an announcement with some other resources Ms. Jordan provided. That's resources that can be used for creating your content. She provided links to that. So that will help you with creating your videos and your posters and whatnot. So I'll share that with you. It will be a folder with all those resources. Okay. All right, so have a good evening. Enjoy your lunch if you haven't had lunch, or wherever you are in the world if you need to go to bed, and have a good night. And we'll see you in the next class.
Thank you.
Thank you, professionals, for your time. And if you have any questions, just email me or call me.
Thank you.
All right.
Thank you.
Bye.